Hola familia, ¿cómo están? Estoy aquí con la doctora Toker, que estamos muy emocionados disfrutando esta fiesta. Doctor, haven't you tell to Mexican practitioner? Because, we are starting to build in Latin America, and doctors are kind of hard to understand the transit technology. Why don't you tell us?
To the doctors,
Yeah.
this technology falls in the same category as physical therapy. So it is a non-medicated therapy, similar to something called K-tape that a physical therapist might use to support a joint. The difference is this physical therapy works like biofeedback to help get the body into a parasympathetic homeostasis. The rest and digest. So because there's no medicine in it, because there's no contraindication to it, it's a very easy first place to start. And your patients would have any sort of a symptom. It's not a cure to any disease, but it does a very good job mitigating symptoms, whether it's pain or difficulty sleeping or stress or anxiety. Long term, if you can mitigate those kind of symptoms, you really can prevent chronic illness. And so that's the whole push to use this technology as the first line of defense before you reach for medicine.
I know. Awesome. You're awesome. Because,
Say that in Spanish.
yeah, I want to translate, obviously. But, this technology helps more, in digestive situation, at mind, neural,
So the technology, so I'm a colorectal surgeon, and so a lot of the patients that I see are complaining of IBS, belly complaints. They're not digesting their food very properly. And they go to doctor after doctor after doctor. They have a lot of tests. There's really nothing surgical wrong with them. There's nothing medical wrong with them. But these people all seem to have a lot of the same symptoms. They will have some either anxiety or depression. You can tell they have that stress personality. They might even be a little tense. And then they have belly bloat and diarrhea, constipation, or both. That's caused by stress. And so if you can mitigate stress, you can improve a lot of those symptoms. So as a baseline, I typically will suggest to those patients to do a peace patch, which is for stress mitigation. It's been shown to improve a patient's perceived level of stress. And then the other one is called the Liberty patch. And that, I like the Liberty patch because it helps set the medulla brainstem back into homeostasis. And as you know, the vagus nerve comes off of the medulla. So I feel like that helps with a neurologic homeostasis. Some patients, that may not be good enough because they now have inflammation. And those people would benefit, if you want to, you can add two other patches. One's called a Lumi patch, which helps improve the collagen in the epithelial surfaces, not just the skin that you see. And the doctors will understand this. The lining of your airway, the lining of your intestine is considered epithelium and is controlled by the same parasympathetic neurologic system as the squirrel. So it's not just making it look beautiful here. It's improving blood flow to the intestinal tract. And so is the Defend patch, was also very good for blood flow and immune.
Nice. Yeah. Oh, a lot. Ok, familia, lo vamos a traducir para darles toda esta información en español, ¿sí? Thank you, doctor.
Bye.